थैंक यू। बैठ जाओ, बैठ जाओ। फ्रेंड्स, मैं प्रोफेसर बीवी मलिक, डीन स्कूल ऑफ सोशल साइंसेस, अंबेडकर, बाबा साहब भीमराव अंबेडकर यूनिवर्सिटी लखनऊ. Actually today I am live with all of you to discuss about the corona pandemic and Indian society issues and challenges. Friends, the entire world is grappled with this corona situations. And as a student of sociology, we should also try to look at these issues to understand how it affects and how it has its impact on people, society, and culture at large. Before going to start, let me try to characterize what is this corona pandemic is all about. Friends, in my understanding, it is a contagious disease which spread because of social contact and interpersonal interactions. The point I'm trying to say that social contact and social interactions. These two aspects make this nature of pandemic more social, but the demand is to restrict ourselves and restrict our mobility and keep physical distance while interacting with other individuals. So the notion here is social, but we have to keep a physical distance, which is otherwise known as social distancing. But secondly, when you talk about COVID-19, it is attributed as corona pandemic, which is essentially categorized and discussed, described in the context of health. But actually, when you look at this, the effect and the impact of this corona pandemic, it is not only associated only health, but also it is much more complex, having socio-economic implications and impact. So the point I'm trying to say that you can locate this corona pandemic beyond the boundaries of health, hospital, patient, doctor, and nurses. The complexities are also beyond geopolitical boundaries of the nations. That means when you look at this corona pandemic, it is across the globe and it makes things global. Essentially, it is caused, this corona pandemic is caused, created, and spread because of the exogenous factors. Exogenous factor in the sense that the source of the disease or pandemic is not indigenous, rather it is exogenous in nature, spread through interpersonal globality. That means because of this interpersonal globality, this corona pandemic has taken this kind of shape and affecting each and everybody's life throughout the world. But when you look at this globality in the context of corona pandemic and look at the epicenter of this pandemic, and it depends, the more the interpersonal linkages you have with the epicenter of the pandemic, the situation of that country is more severe and distressful. So because of this globalizations and global trade, no nation state is confined its boundaries because of this economic interest vis-a-vis the global capitalism is the carrier of this pandemic, and it is widespread all over the world. This pandemic has also broken the boundaries of becoming rich and poor. If you take the example of people in Europe, people in Europe are throwing their money, the currency they use to purchase happiness. But now they think that these currencies are not able to protect them from this disease. So therefore, it has created such kind of situations where this is the situations that money doesn't protect us. Even though you have capital, even though you have money, but you will not be protected from this disease. So the point here is it takes us to become a human. So becoming rich, having money in the context of Europe has revealed the fact that the capital money cannot rescue us from this pandemic. So it means this corona pandemic has brought lessons to us. The lessons is related to humanism. The lessons related to not having much, but to have the essential things to lead your life. In this particular context, if you take these sociological connotations of this corona pandemic, it has not only social but also economic, cultural, psychological, and cultural impact throughout the world. But this can be located, or this can be understood by locating the interplay between people and society. So there is an interplay between people and society, but this interplay is somehow restricted and constrained because of this pandemic. When you look at this corona pandemics, it has brought many positive as well as negative, or it has brought many failures and success. But in this particular context, if you look at this corona pandemic, I refer to a C. Wright Mills, the sociological imagination. In that particular book, in the very promise in the chapter, the second paragraph, it writes that when a society is industrialized, a peasant becomes a worker, a feudal lord is liquidated or become a businessman. When classes rise or fall, a man is employed or unemployed. When the rate of the investment goes up or down, a man takes new heart or goes broken. When wars happen, an insurance salesman becomes a rocket launcher. A storekeeper, a radar a wife lives alone. A child grows up without father. But if you look at C. Wright Mills in the corona context, it is imperative to draw the ideas that, the C. Wright Mills would have been written like this, that when such kind of pandemic occurs, society becomes standstill. Factories, industries, and government offices and school colleges get closed. Further, visiting of guests or social gathering is ceased. That means each social happening, each social phenomena has its context, has its positive and negative aspects. So these kind of social happenings has strengthened the digital notion of society and social relationship. You are being asked in this corona pandemics to maintain physical distancing, but to be in touch with your friends and families and your community at large by video calls, by digital connections. Because of this corona pandemic, things are happening in cyber world. I think by referring the book of Manuel Castells, where he wrote that book, Information Age, Economy, Society and Culture. In that particular book, what he's trying to say that the society has become global and the economy, society and culture has also become global. And this corona pandemic nature is also global. So the point I'm trying to say that the global notion of both the pandemic and related social happenings has laid that the capacity to work as a unit in a real time on a planetary scale. That means now you can work from your home, now you can teach from your home, now you can all your kids must be going online. So and we are also now trying to learn how to become online and to be associated with the people at large. So it has created a different kind of society, I think, where in my understanding, Manuel Castle is correct. And in that particular context, Manuel Castle is talking about virtuality, the culture of real virtuality. What is this culture of real virtuality is all about? This Manuel Castells writes, real virtuality is a system in which reality itself is entirely captured, fully immersed in a virtual image setting in the world of make believes in which appearances are not just on the screen, through in which experience is communicated, but they become the experience in itself. My understanding here is that the Manuel Castells, the notion of global culture, the notion of global society has been the ray of hope in the context of trade, in the context of education, in the context of health. So, with this kind of theoretical framework, we can try to look at this corona pandemic in Indian context. When you talk about the theoretical aspects of this corona pandemic and the situations, specifically in the context of India, it has economic, cultural, political, and psychological connotations. But when I look at this particular phenomena, it is more social as its genesis as well as its consequences. The genesis and consequences of this corona pandemic is much more social than economic, cultural, psychological, and so on and so forth. So what I have explained so far attributes the social aspect of the pandemic, social aspects of the pandemic. But let us look at the happenings of Indian society specifically in the specific context. What are the issues which is grappling all of us, specifically in the context of India? As a student of sociology, you must be knowing that we have unity in diversity. And the present government has introduced several major schemes to strengthen the concept of one nation. The very recent one is one nation, one ration card. That means this will enable the migrant workers. This will enable the migrant workers and their families to access PDS benefits from any fair price shop across the country. So the point here I am trying to locate that the corona pandemic has brought us together. It has trying to bring people very closer to each other. So this closeness, though has its distancing aspects at the core, but at mental level, at emotional level, at personal level, brought us to close together. But in my understanding, when you talk about these issues of laborers in India, or in other words, the issues of marginalized communities, I think there are lot many challenges, and these lot many challenges are needs to be addressed in a very integrated and holistic manner. Of course, the government has taken so many yardsticks and measures to control the situations. But when the first point is about their migrant workers, but the question is why they migrate. Actually, they migrate because of they don't have productive economic resources at their disposals. And since they don't have productive resources at their disposals, they are looking towards cities where they have a minimum sense of, or there is a minimum kind of work where they can engage themselves to sustain their life. But this engagement with this the process has brought many kind of disenchantment and frustrations among them because of this corona pandemic. What happened? No, if a person who has traveled to Mumbai or Surat, for example, to somehow manage his family, but this corona pandemic has created such a situation, his experience is so horrible. He has to walk all the way from Surat or Mumbai to somewhere in Gazipur in Uttar Pradesh. It indicates the hardship. It indicates that how we are not in a position to manage the situations, and but this will have its far-reaching consequences in in the economy, in the polity, in the society at large. They are laborers, they are migrants, but the point here is these laborers and these migrant workers, they are stranded, they are walking miles together to reach their destination places. Somehow is very painful and very pathetic, and I think some kind of mechanisms needs to develop to address such issues. Apart from these labor issues, when we talk about the transfer of food and cash to this section of the society. Now, there are some writings which suggest that these migrant workers needs to be given free food for 3 months, and every individual with 10 kg of food grains per month, along with 7,000 rupees cash. If this should be handed over to this state government or to this section of the society, it may bring liquidity in the economy. It may bring our economy to a kind of situations, but maybe a lot of efforts are being done in this context. But it needs a thorough sociological analysis to find out what is the outcome it. But when you talk about these food grains, and these food grains are plentiful, as the Food Corporation of India had 77 million tons, and Rabi procurements could add 40 million tons. So in Indian context, the scarcity of food is not at all there, but it is the point here is to reach to the people. To reach to the people, how this will reach to the most deserved people who stays at the bottom of the society. Secondly, putting money in the hands of these poor may stimulate the economy. There are many economists those suggest that this will stimulate the economy, and in this particular context, the Manrega work is also much more uh, initiated or much more given importance. So the millions of migrant workers have endured immense hardship to trudge back home and not like to return to forums in the near future. So they have to be given work at their places. Hence, this Manrega needs to be expanded greatly, by which things can be. Secondly, when you talk about poor migrant laborers, it can be also contextualized and located in the context of India and Bharat. So you have both the pictures in front of you. The way our TV channels are showing the laborer sufferings, it depicts the notion of Bharat. Certainly, we need to rethink the notion of India, and whether it is a kind of democratic India, whether it is a kind of India which is envisioned by Gandhi, Dr. Ambedkar. In this particular context, I think this corona pandemic has to be seen in the context of rural and urban. There are people, those who are living in urban areas, and specifically those who are engaged in MSMEs, revival of micro, small, and medium entrepreneurs. So these MSMEs groups, those who are located in some urban areas, I think those who have gone to their residence or to their places and those who stayed back, I think for them also a mechanism needs to be developed by which we can provide them employment and work. So introduction of an urban employment guarantee program may be the need of the hour. Urban local bodies must take the charges or take the initiative to to somehow uh, bring this situation under control. Now, I was having a study while I was looking at this. The Azim Premji University has done a kind of study on COVID-19 and the context of employment. I think they have surveyed around 4,000 people in 12 states. But this, the survey results, what it suggests, that 67% of laborers have lost their employment. What does it mean when the 67% laborer have lost their employment? It means they all work in the unorganized sectors, and out of this 67%, the 80%, I think that means out of 10 persons, 8 persons has lost their job, and out of this 10 ratio 8, you'll find 8% again self-employed, and 80% are casual laborers, and 76% are regular salary employed. I think these are the situation in. But when you look at this particular study of Ajit Premji, uh, but the data suggests about 57%, or out of 10, maybe 6%, 6 people in rural areas also has lost their jobs. So actually, this corona pandemic has a very significant impact on the economy, and specifically on the poorer and poor households. Apart from these economic aspects, this corona pandemic has also brought many psychosocial consequences. Because of this corona pandemic and health hazards, our anxiety level has increased, and nobody knows how long this kind of lockdown and this kind of situation will continue. So therefore, in the families, in the households, the level of anxiety, worriness, stress has increased, and there is kind of uncertainty about job, uncertainty about economy, uncertainty about the lockdown. I think this kind of uncertainty is going on, which are maybe directly or indirectly creating a stress kind of situations among the society at large. Second kind of stress or second kind of challenges as far as the socio-psychological consequences of this corona pandemic is of getting the fear of getting COVID-19. So there are always a kind of no crisis in your mind that maybe how I can keep myself protected and by which I will not catch this corona pandemic. So that kind of fear is always there, and maybe you at your household level or at your family level, you are always being asked to wash your hand, do this and do that. So kind of stress which is being created specifically among the section of the society. Uh, the third important anxieties or worries and stress may be because of the social media. All the time we are trying to use our social medias, and the social medias also, or the communicative medias also bring so much of distressful informations and um, news by which it adds to our worries at this particular context. So changing life and life cycle, shifting of jobs from office to home. Actually, when we talk about how sociology has came into exist, maybe it is because of the notion of society has changed from agricultural society to industrial society. Maybe in that particular context in Indian society also, so because of this corona pandemic, the nature of society, nature of job, nature of work has changed. You all are requested to work from home or study from home. So the point here is that there is lifestyle which has also changed, and it has a kind of, it is impacted or it is happening because of this corona pandemics, and nobody knows how long this will continue. So restlessness is part of our life, and I think that has brought many kind of frustrations and anxieties at family and household level. So my suggestion to be all my students, those who are listening to me, maybe you need to structure your day. That means you have to plan your day, and you have to do follow your own routine, and you need not to reverse your life cycle. No, because there is no work, you may be sleeping late and getting up late. That's not correct. Maybe you have to structure your life, you have to structure your day by which you can get into your things. uh, so therefore the point I'm trying to say that because of this corona pandemics, so we have to have uh, these kind of challenges, and we need to overcome these challenges by which maybe we can in a position to uh, control this paranoid control. So my suggestions are maybe my humble submissions to all my students and those who are listening to me, that you try to keep yourself in a positive mood and have a positive attitude. And uh, as a student of sociology, you also need to try to find out what kind of concepts and theories can be developed out of this. So certainly it will help us to understand society in future. Thank you very much for having patient hearing. Maybe I'll meet you all in next time. Thank you very much. Thank you very much.